Bismillahirrahmanirrahim. Assalamu alaikum viewers. I am Dr. Nauman Tarif. I'm a consultant nephrologist and we are going to start a podcast, Bloodless Dialysis podcast. Bloodless dialysis, as you know, is also called peritoneal dialysis. And this will be a series of podcasts with eminent nephrologists that we have in Pakistan and internationally also. So what we are going to do is we are going to start today with the first podcast with the title of A Young Nephrologist's Journey into Bloodless Dialysis, Peritoneal Dialysis. And we have Dr. Mohsin Riaz. He's a consultant interventional nephrologist and he's at Umar Hospital, Lahore. So I welcome Dr. Mohsin Riaz. Welcome, Mohsin.
Thank you, sir. Really grateful for this opportunity and thanks for inviting me to this program.
Thank you very much. Now, this is your first podcast?
Yes, this is my first podcast.
This is my first podcast also. So maybe we will fumble a little bit here and there. But I think it will be okay.
Inshallah.
And it will be easy in the future also.
Inshallah.
I will bring you again. I will see, how we change afterwards.
So we can have a look back.
That's good. So we never look back. That's the main reason. That success.
Just for the improvement.
Absolutely.
For the sake of improvement.
Absolutely. So the sake of improvement, for everything. So there has to be experience. And when you have experience and then you evolve into something that is beneficial for yourself, for your community, and everybody around, including your family. So what we are going to do is I'm going to ask you a few questions and, we'll move forward as we go along. And the first thing I would like to ask you is, what brought you to nephrology?
Actually, this is...
I'm not going to say, ab doctor kyun bane?
No.
So, because we are beyond that, we are going to go into nephrology right away.
I mean, nephrology, actually, it's a very interesting decision. So, I still remember back in 2007, when I finished my house job, I was just thinking about my future career. So, I asked my seniors, and then I went one of my family kind of person.
Advisor, you mean?
Advisor, yes. Family advisor.
Yeah, there are many people, among the family who just guide you.
He told me, to be honest, I was thinking of the neurology.
Is that right?
But he advised me.
To be honest, I wanted to go into neurology also.
It's really interesting, sir. So it's interesting. So I never knew this. So he advised me that it's better that you should join nephrology. And I was kind of shocked. Honestly, I was shocked. Because I was never able to understand nephrology during my MBBS. It's a very tricky kind of a subject.
Yeah.
Electrolyte, cysteine base, and everything. So when he told me, yes, you should go into the nephrology, then I started looking around and I found that it is a very rare specialty. At that time, there's only Sheikh Zayed Hospital. And there was no one, there's no other consultant.
That was which year?
2007.
2007. 2007, such a big country, so many, millions of people and patients. And it was unfortunate that it had not developed.
So actually, I was just thinking that where I have to go after doing the 2 years medicine. So I couldn't find any place other than Sheikh Zayed. So I think the viewers should know about you, that you are the main supervisor of nephrology. So Dr. Nauman is my supervisor. So
I am honored actually to have a good student also.
So actually, sir, this is very important. So I was in Services Hospital, and I came to know that some Dr. Nauman has came back to Pakistan and he's a nephrologist. And that is a very interesting news for us, that some other place other than the Sheikh Zayed will be available for the training. And I don't know if you remember or not, I first met you in Services Hospital, Medical Unit 1 ward, when you came to attend a call for a PD patient.
Oh, is that right?
Exactly.
So, it was...
I don't know. So this is something...
connection of stars somewhere,
So मतलब कहते हैं ना, लगता है जी कि जो आप बताते हैं वो जिस मकसद के लिए आया होता है वो पहुंच जाते हैं. So
Similarly, I got interested into nephrology because of the house job. During house job days, we had patients, who required dialysis, and then we had to put, PD catheter cured. So that was very interesting for us, saving a patient's life. And then, we saw Dr. Tahir Shafi Sab. These are the people, who guide you or, become a, mentor in absentia. Even you don't meet them, still you get some light from them.
Exactly.
That's great. Great.
So the next part. So because we have seen in the services hospital was when you send a call, usually consultants never showed up themselves. They just write few words, they send the paper back. So that was the first experience that I was surprised the consultant is visiting himself to attend a call. And there's a 1.5 page directions and total guide here how to do this PD. I still remember this was an old lady actually.
I may be young also, writing long notes.
So there was some fiber coming into the pipe and guiding me how to clean it, how to flush it. And I was surprised. I literally mentioned to my colleagues that this something astonishing happened.
Thank you very much. But, your point of, the other consultants, I would say, when you are going to be a senior consultant again, you're just going to write down 3 lines because then you are very focused and you're going to write down a few things there.
But I just can't forget that scene.
I thank you for that, But I'm very happy that I made a difference somewhere, and I'm very happy that, you are here and you continued the light there. Now, before, we go forward, let me just ask you, you were part of the ISN fellowship program, right? So in ISN fellowship program, what happened? I mean, how did you get into that?
Actually, the way back during the last years of the training in the nephrology, so I still remember we had only 5 patients of peritoneal dialysis that were handled by you actually. So the time the patient came to the hospital, there was kind of a afra-tafri. It was a PD patient is coming, no one knew what has to. Okay. And so, I would like to say, literally, we don't have any idea कि हमने मतलब करना क्या है इसके साथ.
Exactly.
क्या हो रहा है. But जिससे जी पता होता था जी कि ठीक है जी bags, you are putting in the bags, we are training it. अब इसमें what kind of problems that we can see, what can happen to the patient, how to monitor. We had a good experience in dialysis, but for the peritoneal dialysis, we had no experience.
Exactly.
And
this is, how you evolve slowly, gradually.
So actually, that was a point then where we had a few patients of the peritoneal dialysis, and then I came to know about the ISN fellowship.
Good.
So at that time, I remember there was they asked me to search for the centers. So I was trying to find a center that is good for the intervention, including the pump case and the peritoneal dialysis.
Good. So your main interest was because the main idea, you're absolutely right, is the problem is, putting in a catheter for peritoneal dialysis. And even for the pump catheter, you need to get some training there.
Yes.
Okay.
So because a pump cath was another issue during my training that when I found it's very difficult to put in the pump cath, and PD so it's a kind of a rare entity.
Exactly.
So then I found a center, and that was Beijing, Peking University First Hospital. So I contacted the mentor, Professor Joe there. And he was real kind, and he accepted my request to take me as a trainee, as a mentee rather. So then I approached the ISN. I write all the letters, and I think if you remember, Lord, you went to the ASN conference.
Okay.
And it was just last 10 days, and you wrote me few letters from there.
Sure.
And from there, you contacted Dr. Azman, and you contacted Dr. Zahir Rafiq.
They were the president and of the Pakistan Society. Because a lot of role of Pakistan Society of Nephrology in promoting this.
I needed the recommendations from them.
Good.
And I still remember, it was just a kind of, it was another, it was लग रहा था कि जैसे possible नहीं है. So it was surprising.
Let's say, let me tell you one thing. When we are here, I feel sometimes that when we discuss many things or when we face some problem, we always think, this is not possible. But, this is something that we need to learn. And from this experience and, my experience, because where I learned it from USA when I was there in fellowship. And if you see that, in the American, there's the last words are I-CAN. So the American children, they are told that I can. So that's a, a psyche develops that you have to do it and you
Actually,
can
there
do
were
it.
only 2 weeks at from the closing date when I came to know about the ISL
Yes.
fellowship. So
But, God is there, he was,
we finished all the papers in 2 weeks.
he was making it easy for you. Alhamdulillah.
Right.
That's great.
So then when they gave me the final, I think after 3 months they had announced the results. It was another day of joy when I came to know that I have been
Right.
accepted as a in the ISL
So
fellowship.
it was a great turning point for you, I would say, So tell me about your experience in China and about the country itself, it's the culture.
So
Was it a cultural shock for you, or, you felt a little comfortable, or?
the only main problem that I found was the language barrier. Actually,
Yeah, that's
it's a huge language barrier.
It's true.
But
But I'm sure you learned few words and you were able to say
only ni hao.
ni hao. What does that mean?
Good morning or
Good
welcome.
morning, ni hao.
That's nothing else.
Okay,
It's very
good.
difficult. Actually, it says it's Chinese very difficult.
Yeah, I know. It's so many dialects and, Mandarin and other, Cantonese.
But the good thing is that their graduates have to do English course.
English course also there.
They don't get the bachelor's degree unless they pass the English.
In fact, we had many, research scholars in USA who were from China, and they used to, speak, quite good English there also.
Yes.
So, I mean, there is some, dialect and stuff there.
Within the hospital, so there was no issues actually. So I used to communicate with them. They can communicate with me. So I used to ask them. So they talk to the patients. And
So what about the Beijing itself, the city? I remember I went there in 2011 and I told the guide that I'm going to take a taxi and I'm going to go to the same hospital, the first Beijing hospital, to see Dr. Dongji. She's a PD consultant there. And the guide was said, oh, how can you do that? You will get lost and stuff. So they arranged someone to escort me with them and go there, and then, they brought me back.
Okay, so
This is a huge city,
it's a huge city exactly. But this time when I went there, I was able to use a Google Apple Maps actually.
Okay.
So I think within first 24 hours, I was navigating through the Apple Maps and their subway.
Is that right?
So, without any guide with anything.
I would have definitely got lost.
And the doctor who received me, he was surprised and kind of shocked. Yeah, how can you do this? I am doing this.
That's great.
So that's what I learned within first 24 to 48 hours. I was navigating myself.
So were you cooking there yourself or what?
Yes, obviously.
You lost some weight, I think,
Yes.
because you were not able to cook as good as your
It's
wife.
around 10 kgs.
Oh, so that's was it good in a sense,
Because I was also doing cycling actually. So not only the diet, because I tell you the important is it was around the time duration from my residence to the hospital on bicycle was 20 minutes,
Uh-huh.
on bus was 35 minutes, and on subway it was 30 minutes. So
Okay,
it
good.
was much better to go on the bicycle.
So you lost weight and,
Yes.
more healthier, huh? That's great. So let's go back to nephrology now. Now, so ISN Fellowship provided you with the interventional nephrology,
Yes.
background and help, and you were able to learn from there. So when you came back, what were the difficulties, or how did you set up yourself?
So actually, I will like to mention here that the Beijing the department of nephrology at the Peking is very well organized. So it has a separate section for the peritoneal dialysis, headed by Professor Dong. It had a separate section for the vascular access, where they put in the pump gas, where they put in the these fistulas,
Fistula also.
the fistuloplasty.
By the nephrologist?
Nephrologist. They do the fistuloplasty, they do the fistulogram. There was another section. There was a separate section that was handling the indoor patients and ICUs. There was a separate section that was doing the hemodialysis, and there was a separate section that was handling the research. So there were different heads. They all cheered by Professor Joe.
Good.
He was the main dean of the unit, and he was taking it. So there was a huge department and very well organized. So if just talking about the peritoneal dialysis patient, they had a cohort of approximately 450 to 480 patients.
Wow. 480 patients.
480 patients, yes.
I think in Pakistan, yet we have like total somewhere around 200 patients all over Pakistan.
All over the Pakistan.
And it's one center having 480 patients.
And
How did they manage that? What they were doing, how they were managing?
they had developed actually an online mobile app which has a patient access and a doctor access. So the patient is sitting at the home doing the surgery, putting in the developed volume
Information all about developed volume.
and they had a chat area in that app, so he can send a message on the chat to their respective consultant or respective they had staff nurses. So basically the staff nurses there were responsible for the management of around 20 patients each.
So each nurse was managing about 20 patients.
One was 20 patients. So she or he was responsible.
Do you think our nurses going to be ready for 20 patients each, or
if they not now actually, if they can handle even 5 to 8 patients, that is quite enough for now.
enough for now?
But this is not it's not very big difficult
Because it's a the learning curve
exactly.
as much
So they were
understand.
actively, the staff nurses actively involved patient management. They used to call them for the follow up for their labs. And the one important thing was because the supplies were issued from the hospital, so patient has to visit after a month, so he cannot skip a visit.
Good.
And plus, another thing was that they had a weekly case presentation where staff nurses used to present the case.
Here I remember, one of my patients, he got his catheter done, and it just vanished, from here. So I could not see him where he is. So after some time, we saw him about a year later. He said, I used to just get the fluid and then, just do it myself.
Yes.
So that just suggests, it's an easy therapy.
It's very easy.
Peritoneal dialysis, bloodless dialysis is not that.
I have still few patients that I passed the catheter 3 months back in the Bahawalpur, and now she only one online consultation. Now she's off the scene.
But that's risky also,
It's risky, but
and but it's easy also. But then it's a two-way thing.
exactly.
So we have to inculcate with our nurses, technicians, technologists, and the doctors.
Once the system is established, so there's no difficulty handling 20 patients.
So what I understand from you is that it is the system that you have to develop within your own hospital, and that is going to make it easy.
So yes, they have one dietitian. She used to assess the dietary, all the things regarding the patient, their calories, their diet, and for the fluid management. They regularly used to do this body composition with BCM.
BCM, they were
There was
assessing the fluid and all these things.
fluid management.
Yeah. See, there is a lot of cost involved also.
Yes.
Plus, there is personal involvement,
Yes.
to HR and all these things. It costs everything costs a lot. What is the system in China? It is like insurance system,
It's
or
an insurance system. If the one who is not insured cannot have good health care.
so it has to go to other hospitals and get something else.
And the one thing is that there is a nephrologist themselves were putting in the PD catheters. So that was a great motivation. That time I thought that I have to do this when I go back to Pakistan.
And there was Professor Dongji who was trained in USA. I think she came back and then set up all these
And
things.
her attendees were doing the catheters themselves.
Great, excellent.
Exactly. So all the catheters they were doing in the local anesthesia, and for the laparoscopy they used to take the help of the surgeon
there.
do themselves.
Good. So tell me about the work ethics in terms of the physicians and the residents. How did they behave in terms of being part of the whole system?
It's very well organized, and so all the SOPs are established. So everyone knows what he has to do. One is what is meant, what is or her duties. So what are his or her limitations?
Good.
So they know this is the point. Now I have to involve some senior. Though this is the point that I can handle.
Good.
So this is a very well organized system.
Very good. So it means that where you feel that this is my limit, I can't go beyond.
Yes,
I need to ask for help.
do ask for help. Yes.
Yes, and I think help is available even here also. Sometimes we get shy. Okay, no, what my senior is going to say.
Yeah.
So I think that should not be there.
It should not be like this. I think there is no shame in asking.
Exactly.
So this is, I guess, actually this is learned from you. So I literally stand on the patient and call any consultant. If I have some problem, I just call them and ask me whatever.
Absolutely. And mostly, everybody is very helpful.
Exactly. And it is very helpful in the patient management.
And what about the Chinese patients? There's 480 patients, a big population for one set.
What I found is that the basic nature of the patient is same. So that is
In a positive way or in a negative way?
either both ways.
Both ways.
Both ways.
Oh.
Same difficulties in telling them, okay, you have this problem, so motivating them, and then putting them on the PD and then training them. I remember I had 2 patients were inducted during my stay, 2 or 3 new patients that I followed thoroughly. So initial days, initial 2 or 3 weeks, they were very difficult to handle them.
That's right.
They were not following their commands, they were not following their direction. So I think he came 2 or 3 times with the fluid overload.
That's right.
So I think this is, so I found that it's the same patient mentality. Patient mentality is same, only the atmosphere is different, yeah, but the way you provide them the health facility is different.
And the way you provide them the education, the patient education, they keep on hammering them, okay, you need to do this, you need to do this, you need to do these kind of things, help. So the system itself, as you said, the nurses were providing a lot of follow-up there.
So see, they used to call every patient once a week.
The once a week, if I, could I call a patient, it's definitely...
They have their logbook maintained.
Is that right?
So they call and maintain the log.
They tell them so many minutes call and what was discussed.
Every monthly lab, the same app that I'm, I think the app, I don't remember the name of the app. It was such a PD for life, I guess. PD for life. Yes, this is the name of the app in China. So in that app, they enter monthly labs, and you add by the end of a year, you have all the graphs. You have the all bar charts and everything.
So you can take all the data.
Yes, all the data. You know how much ultrafiltration, how much HB, what was the calcium, what was the phosphate.
It's a great help.
It's a great app. Yes,
it's a great help. If you want to do a research, what kind of patient, what is the...
Readily available.
Oh, wow.
For every patient, for a cohort, everything readily available.
I think you should probably try to develop that.
I tried to develop it here, the problem was that the software, at that time I think it was not very much expertise, but now we have experts available.
Yeah, after COVID, it's an explosion in the IT industry.
Now I think now we can do it.
Okay, I think that's a project we should probably, discuss together again with other like-minded people.
Actually, it brings the main the idea of this was that they first started in the Beijing. Then they spread over the Beijing province, and then they was planning to separate it across the China.
Right.
So it readily provides us with the PD registry as well.
Oh, I see. So every patient is included over there, and then just take some coffee also. While I just think about the next question. So now let's come back to Pakistan. Now in Pakistan, what kind of patients do you think are the main population of kidney disease that you see usually commonly here?
It's in Pakistan or across the world, across the globe rather, it's diabetes that is number one culprit.
Even in China also?
Even in China.
Is that right?
In China.
That's true.
Still,
that's true, I mean, majority of our patients are diabetics. And we have to, deal with them with all these complications. Yes. And what about, PD? Is it good for patients who are diabetics also? Some people say, diabetic, it's
some at times we have to struggle with the sugar control, blood sugar level, but it is not that difficult. If you strictly follow, you get the diet plan, and you follow the insulin or whatever the drugs you're giving, so we can control. I have many patients, and we are well controlled.
Yeah, I have also a few patients with diabetics. They are quite okay, They're doing it quite fine, and I don't find too much of an issue.
Initially, it was said that you should not put the obese patient on feeding. Now it's not.
Exactly.
Now it's again a myth.
I remember Dr. Bagman, the famous Dr. Bagman, she's the guru of PD, and even Dr. Oreo+, I had the chance to see him in Saudi Arabia when I was there. They used to say, any patient is for PD. There's nothing for... You can't say no to any patient that you can't go on PD. So you can... Yeah, okay, good. Now, where do you see, bloodless dialysis or peritoneal dialysis in Pakistan? What is on the horizon?
Actually, the peritoneal dialysis is the future for the renal replacement therapy. Considering the huge electricity costs, considering the water reserves. So I think that we should, by default and by policy, move on to the peritoneal dialysis.
You're absolutely right. Water loss in preparing fluid for hemodialysis is huge. Liters and liters of fluid for a single patient.
Exactly.
How many liters? Like 100 and...
it would be like...
120 or something or more? No.
It's a 120 liters 120 liters per session.
Per session, 120 liters.
Yes.
And for 120 liters, they have to waste almost like 100 liters of water. So it's actually for one dialysis sessions, you're using of 200 liters of water. That's, think about Karachi, other cities.
I think this is the main issue that we need to highlight.
And I think the other government does not understand, or the different authorities, the administration, they don't realize how much water is being lost just for preparing this thing. That's a very important. And how about the acceptance of bloodless dialysis, the peritoneal dialysis in Pakistan?
So yes, so I think let's just come back to the time when I came back to Pakistan and started the PD project here. So initially it was very difficult even for the administration to convince them that we are starting a peritoneal dialysis program.
Absolutely.
So finally, once we convinced them, then there was the time to take out the patient. So every patient wants to have some example.
Mm-hmm.
If you tell a patient that yes, you should go for the PD, he will ask you, please give me the contact number of some patient. I want to talk to him or her.
And that has helped many patients.
Exactly. So the problem because it is not very common. So I was just before the podcast, we were talking about the CPC that I gave today. Even the medical community don't know about the peritoneal dialysis.
Absolutely.
And
a lot of education gap there.
Exactly. So when I just talked about the peritoneal dialysis in CPC, I think there was around 50 doctors there, and only those who were directly involved with me, the surgery team, had some idea about the peritoneal dialysis. Otherwise, totally unaware, and they told that we are totally unaware of this modality. So there is education gap. We need to educate the medical professionals, and once the medical professionals are educated, then we can have a more better PD programs and more patient on the PD. And one more thing that I want to highlight, that initially it was difficult to take the patient or convince the patient. Now patients are coming by themselves.
Exactly.
Many patients approached me and called me for the peritoneal dialysis. They met I will like to mention 2 patients from Sialkot. So there is one patient, she is on peritoneal dialysis for 2.5 years. One of her relative and one from their far relative and one from their neighbors. All these 3 came to me for PD after seeing that.
Wow.
So this is how it is.
So it trickles, from patient to patient, the other.
Because the patient outcome is good, patient is eating and normal.
But I think that is a very slow process.
It's a slow process.
We need to, increase the process just by encouraging all our.
Still, it is gradually growing.
Good. So any few hurdles that you think there are in bloodless dialysis that we need to overcome?
It's few hurdles. The number one hurdle is the education.
Yes.
Medical education for the medical people. The paramedics and doctors, everyone, they should know about the peritoneal dialysis. Secondly, how to initiate the PD. Once you are decided, so say I have decided, yes, I have to start a patient with peritoneal dialysis. My next question would be, who will pass the PD catheter?
Yes.
If you send to someone, surgeon who has no idea what peritoneal dialysis is, he will just take it like as a
exactly.
Dream.
We had this experience before.
And so this was the main, I will say my main motto when I came back, that I have to do it myself.
Good.
So it was a slow journey, but
I think it's a great blessing. Let me say it, Mohsin, in front of you, that we have made a huge difference.
Yes,
and the good thing is, you have been teaching other nephrologists. Yes. And even, the training the surgeons how to put the catheters. So that is, it's a great thing.
Found some surgeons who were interested in it.
Good.
Because initially I was, to be honest, I couldn't do it myself. I used to assist a surgeon for like 1.5 years. Then I started doing in fluoroscopy. Then I did it for another 1.5 years. Then I had some complication, and then again talked to another surgeon. He told me, just now you're having this complication, now you should move forward. Now you should put in like with an open technique. Then he assisted me, and I did the procedure with him. So after like another 5 to 6 months, now I'm doing my all with fluoro and with open technique, I'm doing myself.
Yeah, you're absolutely right. It just needs a few catheters to put in.
Yes.
And then you're well versed with it.
You have to be committed.
That's the main thing, absolutely
but
right.
You have just have to do it, then you have to do it.
It's not just putting in a temporary catheter or just a perm cath, simple as you do it routine, but it's something, beyond that.
The one other thing that I want to highlight, if you do any procedure, there are complications.
Yes.
So we should not get afraid or worry about the complications.
True.
So I still remember the first patient I started with the PD. I think he passed away very soon, and the patient family was complaining that this is because of the PD, but it wasn't the case. Actually, he was congestive heart failure and massive overload.
And actually,
low BP, 90, 90 by 60 blood pressure.
Yes. You see, initially what we had the patients were, or still sometimes, these are the patients who are very critical patients.
Exactly.
Congestive heart failure patients, and just in the last stages or something, and they want something to be done for them, and PD is probably the only option for
PD is
them.
a good option, exactly. Plus, PD is a very good option for all those patients who are candidate for the renal transplant.
The renal transplant. Good.
So
This is a very important highlighting point, that if you are going to go for renal transplant, it's better, you go for peritoneal dialysis rather than hemodialysis. Yeah. So much of a problem in terms of cross-infection with hepatitis C and all these things. Yes. Anemia, absolutely right. They need to get blood transfusion, then they develop, rejections and all these issues.
Titers increase and there's also rejection phase.
So any suggestions, how to overcome some of these things? Any other issue other than these things? What about the fluid and other things?
I think the main issue that we faced in the start of this year, when we are suddenly inducting many patients.
No.
So the projection of the company who was providing the PD fluids, it just was not that.
Yeah, it's lapsed because, they just collapsed.
The system suddenly collapsed. We were unable to get the fluids. So then we have to stop the patient induction. And I still remember, I think I refused around 5 to 10, at least 10 patients I refused.
Must have,
Just for...
And that's only you, the other nephrologists.
Just because they came to
must
me for
have,
the peritoneal dialysis, but I told them, how can you manage?
Yeah, this was the case.
And I still remember the one patient, I just lingered her on. She was on the baseline, like creatinine of 5 to 6. Creatinine settled, then I guess, okay, wait for few more time. And I think she... after the 3 months when I get the supply, I put her on the PD catheter, peritoneal dialysis. So there is
these are some of the things that we're going to face, but I think in the future it's not that bleak there. So in the end, I would just like to ask you to give some advice to the young nephrologists. Your journey, I'm just bringing you in here as the first podcast is because I want to highlight that, when you start something and there are so many things that open up for you.
Exactly. So if I look back at my journey, so it was actually the time you are doing something, you don't realize that how much effort you have put in.
True.
But when you look back, then you realize, yes, I have done this, and how is this possible?
Yes.
But if you are committed, or if you think, yes, I have to do this.
I have to do.
You do anything with this.
Like the famous logo, I can.
Yeah, exactly.
Just do it.
So if you want to do something, just stay committed and continue your efforts. You will be get a payback.
Absolutely. I think I've taken a lot of time. And I'd like to thank you. Always a pleasure to seeing you here.
It was
thank you so much.
Wonderful talking, sir.
Thank you very much.
Thank you.
Okay, guys, we'll just wrap it up here. So we had a wonderful discussion with Dr. Mohsin Riaz. He's an eminent interventional nephrologist. And I think the message is clear. If you want to do something, you just plan for it. And the God and Creator is going to just be with you. And if you are, right on your path, things will be okay. No issues. Till we see you next time in the next podcast. Thank you very much.